Today is World Skin Cancer Awareness Day. Some refer to it as a Melanoma Monday, which seeks to educate and inform people about the warning signs, the risks, and preventive actions. Every year, the first Monday in May is marked as a day dedicated to highlighting the importance of early detection and prevention of melanoma, the most serious and deadly form of skin cancer in Nigeria. The Albinism Association of Nigeria, an organization committed to advocating for the rights and welfare of persons with albinism across Nigeria, is calling on government to train healthcare providers and teachers on specific needs, enforce anti-discrimination laws, and also include sunscreen as an essential medicine under the NHIS. Let's bring in the chairman, Albinism Association of Nigeria, Lagos State Chapter, Tolani Ojulari. Mr. Ojuri, thank you for joining us on the news this hour.
Thank you for having me. Good afternoon.
So your association is pushing for sunscreen to be listed under Nigeria's NHIS as an essential medicine.
Yes.
Why is this critical for persons with albinism, and what's stopping government from actually approving it?
Well, it's critical. Sunscreen is essential for us due to the fact that we don't have the melanin which prevents the UV rays of the sun from affecting our skin. So with the absence of that, the sunscreen is what we use to protect ourselves from the effects of the rays of the sun. And with the economy at the moment, even before it got this bad, sunscreens don't come cheap. And the sunscreens we are referring to are not your regular sunscreens. Sunscreens with some protection factor of 50 plus and above. And most of the time, you don't get that just off the shelf.
How much is a bottle now?
A bottle of sunscreen now is on about 20,000.
Wow.
Basic.
And how long does it take to use one?
With a tube will last you 3 weeks, 4 weeks, and they're done. And because something you have to apply constantly, every two or three hours.
What kind of intervention have you received from the Lagos State government, for instance?
Well, we've in the past 2 years, we have the Lagos State Health Insurance Scheme, which doesn't cover us, and the government moved a notch higher. We had a special intervention from Lagos State government for skin cancer patients, and we've had the third batch who had some had surgery, some went through chemo, and we have one person going through radiotherapy at the moment. The government did not stop there. They went ahead to provide us with sun protection materials, wide brim hats. They also bought us sun protection. They also got us sunscreens with SPF 50 plus, and they also got us umbrellas with UV protection.
It sounds like you guys are fine. You don't need any other help, right?
Well, we thought so initially, but this is the second year of the program, and we felt we're good with even surgeries. But to our surprise, we still have people show up at the skin cancer clinic, at the skin clinic in Lasud every week. And you try to find out from them, where have you been? Because we can't keep on treating skin cancer back to back, year after year. No, it's not cheap. To treat one skin cancer patient runs into millions of naira. And we felt, since we've treated the first, second, third batch, it's nice for us to go on public campaign, make sure that there's awareness for this, but just find out you have people presenting stage 2, stage 3 cancer, and it's like that would not
precisely
really
how do we make early detection more accessible?
Well, with Lagos State government, and because we have a good relationship with LASU, that's the Lagos State University Teaching Hospital, we always urge persons with albinism, anywhere you find one within Lagos, just show up at the skin clinic, because early detection has shown that it works for us. It's just one of those cancers that you can pick it easily, because we don't have the melanin. You just by sight you can tell, oh, this is just cancer coming up on you, and just with surgery you're good to go. But the moment you start having the patient go for chemo, radio, the chances really get very, very low. We have a few, I think we had just 2 or 3 that we lost during this particular program. But we are not still that good. We still need more. We still need funds in the area of awareness, in the area of, we still need more funding in that area, and we still need more sun protection material.
So just for clarity, do we have the intervention coming from government?
Yes.
Does it cover for everyone who shows up? or there are more people than what is available?
Yeah, it covers for every resident of Lagos who shows up at LASU. But it's a fixed fund, and the fund is depleting.
Oh, okay.
So we need more funds, because the funds don't come to me. Lagos State pays the funds directly to LASU. So we have a line of funding at LASU, and the funds need to, because it was more or supposed to be just one intervention, and we clear this off, and we just focus on awareness campaigns and all that. So that is it. I mean, funds is, we need a constant rolling fund, and we still need more sun protection material.
Beyond health risks, talk to us about where we are currently with stigmatization and myths, especially in Lagos.
Yeah, that still brings me back to awareness, because we've been on radio and on TV across stations over time, but we still found out that we still have a large percentage who are still not aware. And so this year, we decided to go out on the street, to go to the churches, to go to the mosques, to go to the motor parks, to the marketplace, to have a one-on-one with people. Because you tell me, oh, you guys are not many. To tell the guy on the street that your brother might give birth to a person with albinism, ma'am, your child, your grandchild might. So you know how to deal with these people. There's no myth around it. We only lack melanin, and we have low vision. With glasses, we could always correct that. You can marry someone with albinism and you have very fine kids. It's not a death sentence. If you early intervention with use of glasses, the person would live well through life. If you early protection of the skin, once you have early protection, by the time the child is a teenager, the chances of skin cancer is pretty low. So these are the things we're taking to people, community leaders, religious leaders. We're bringing them into the fold to really have a one-on-one with them, because you'll be surprised that you think people know. A lot of people still don't know, because when we go out for these campaigns, the kind of questions they ask us afterwards, you're shocked.
What factors would you say aggravate skin cancer for people with albinism? Exposure to sun?
Basically, exposure to sun.
Basically. So it now brings to mind, how do you escape sun in Lagos?
You stay out of the sun. Basically, stay out of the sun. Because a child going to school, for instance, you educate the school management. This child cannot go on break, cannot play football.
Even with sunscreen?
No. You can't. You talk to the child and talk to the management. This child can't go for any outdoor activity. Exempt the child from outdoor activities. And because skin cancer doesn't show up now, today. Sometimes it takes 10 years. It takes 15, 20 years before it shows up. So that's why we tell people, just stay out of the sun as much as possible. It's possible if both the management and the person with albinism are made aware, they're good to go.
Are you advocating for exemption laws? Because this is just beyond not allowing children to play. There are people, for instance, who work in places where they are required to go under the sun. What kind of systems do you think we need to be able to help persons with albinism in this regard?
The laws does not pinpoint cover that. And that's why you can't have a person with albinism into construction, into real outdoor construction. You can't have a person with albinism, say, controlling traffic in broad daylight. No, that's a no-no. You can't have a person with albinism. Exposure to the sun, I still say, is a no-no. So that's why, even when we see them, and like, oh, this person came to look for a job, and that's why we kept him there. No, it's like him trying to commit suicide. Because yes, it won't show now, because it just like, oh, sunburn comes up, the man goes red, he goes, but after a while, it still comes down to skin cancer, and it costs a lot of money to treat, and that is even if the person survives it. So exposure to the sun, working in areas whereby that person is stays in the sun all day, or even sometimes of the day, is a no-no. That's why we always advocate, keep this person under the shade. Make sure that they stay in covered areas, either in the office. Sometimes, funny enough, you have a person with albinism insist that they want to walk outside. It's a no. It's a no-no.
Is there a national benchmark for the intervention we see happening in Lagos?
Well, the truth is, Lagos being a center of excellence, what we have here is what we're trying to replicate across the nation. And we're trying to have a national framework with the Cancer Center, whereby persons with albinism are covered in the national healthcare scheme. And you have, once they present themselves in any of the marked out hospitals in the 6 geopolitical zones of the country, those persons are treated. But like I said earlier, you can't keep treating skin cancer back to back. So that's why we're focusing on having a proper database. We track persons with albinism, make sure they go to check their skins every 6 months. There you can trap it, even before it gets to stage 1, stage 2, whereby ordinary pre-cancer creams can sort it out, or surgery sorts it out, so that you can get to the level of oncology departments having to go for chemo, having to go for radio. So within the next 5 years, we're working with the dermatologists nationwide, even though the numbers are depleting due to brain drain. But if you can trap all persons with albinism nationwide, we could always send them texts, send them reminders, go for your skin checks. We will make doctors available, special intervention. Yes, we know that in Lagos, we're lucky we have more dermatologists down here compared to some areas in the southeast or in the far north, whereby you don't have, maybe one dermatologist for 2 states. We're still looking for ways to work around that.
Good place to leave it. We're going to continue. We'll always have this conversation, and I'm sure that we'll continue to have this conversation. Tolani Ojulari is Chairman, Albinism Association of Nigeria, Lagos State Chapter. Good to see you again.
Thank you very much.
Thank you for coming around.